So the next thing we're going to do is go right into our PowerPoint. I'm going to highlight some special features for you about SEIU, what makes us unique, and why we're so glad to have you as part of our family. So why unions matter. As you heard, you get better wages, right? So on average, unionized workers make about $4.50 more than those who don't belong to a union. That is a huge advantage. Retirement security. Our members belong to pension plans like the Healthcare of Ontario pension plan, which is also called HOOP for short term, and the nursing homes and related industries pension plan called NRIP. We also have a low wage retirement security plan called My 65 Plus. And so, of course, unions are able to bring lots of security to individuals. You have an amplified voice, right? SEIU Healthcare has a seat at the table. We work really hard with both the federal and provincial government, which allows us to bring your voice to them and push policies forward that directly benefit you and your family. You know, and as we're talking about that, I'll just specify one of the advantages for you with SEIU is that we are healthcare specific. So we only represent healthcare workers. We don't have prison guards. We don't have teachers. We don't have other members who are active in unions. And so because of that, we're able to specialize and put all our attention into healthcare. So we're very good at what we do. And with that, we also have a special SEIU savings plan, which is unique. And it gives you exclusive discounts on things like cell phones, home and auto insurance, events and attractions, retail products, and jewelry, because who doesn't want more jewelry? Let's just talk a little bit about where we came from and some context about your union and your local. So our first local in Canada was established in 1943. So quick math, we have been around a long time, which is wonderful. We've learned from our mistakes. We organized our first hospital workers at Toronto General Hospital in 1944. And then we began organizing nursing homes throughout Ontario in the 1970s. We have, from 1970 to 1995, we achieved collective bargaining agreements that included things like pensions, workplace health and safety regulations, and language against contracting out. Two major labor decisions were won and are still in existence today from an arbitration with the Ontario Labor Relations Board around the contracting out of work. This is really important because the defunding of public services allows for more privatization, and we want to stop that because it's not in the best interest of society or for you as a frontline healthcare worker. We also established pension plan for thousands of nursing home workers. So that's right, we helped to establish that pension plan in the passing of legislation that wins the right to strike for essential service workers as well. From 2003 to 2013, we were pretty6 locals, which essentially for this example, let's consider 6 cities who got together, right? They're each unique and they have different members involved, and they decided to pool their resources together to become, let's call it GTA. And so this happened on a provincial level, but what it allowed for was strength in numbers, right? More resources and a better ability to take on some of the challenges that are continuing to present each other. We became the first healthcare union in Canada to also receive an automatic recognition from a provincial labor relations board, which is huge. And then SEIU Local 1 Canada decided to rebrand itself in 2013 as SEIU Healthcare, which is what you know us as today. Whew, that is a mouthful. So who are we? Who are you is the better question. You are part of over 60,000, that's right, you heard me, 60,000 frontline healthcare workers across the province who work in hospitals, long-term care homes, retirement, home, and community care services. We have 473 workplaces represented, and we have nurses, PSWs, environmental service workers, lab techs, porters, paramedics, DSWs, and more. And from a geographic perspective, we have members all the way up in the north. I saw a few of our staff are with us today, and that includes North Bay, Miskaming, Elliott Lake. We're out in Ottawa, we're Southwest Ontario, in London, Hamilton, St. Catharines. So we are a big, bad family. So just want to cover some of our victories so you can see, for example, what we've been able to do. We won what was called a Sweet 16 campaign. We fought so hard to get a wage adjustment with the government for PSWs and home care that better reflects the work that you all do and did back then, if you were a PSW. And so the $16 is the minimum wage standard that we were able to win and lift home care workers out of earning poverty wages. We also had the hospital tri-union campaign, which went down in 2017, and we worked in partnership with CUPE and Uniform to win yearly wage increases of up to 1.65%, which was able to get us ahead of Doug Ford's bill, Bill 124, that he brought forward when he came in, that capped wages at 1%, not keeping up with inflation. All right, Long-Term Care Central campaign. We ran a public advocacy campaign to win a 3-year agreement that gave 1.5% wage increases each year, night shift premiums, and introduction of a workload review form. So collectively, we got together. That was a photo of your bargaining committee. I know you kept hearing our officers say, get involved, get involved. All these folks stepped up. Some were new to it, some not. And we put our power together to win all these collective things. Pandemic pay, super relevant right now. We fought hard and put pressure on the government to grant wage premiums for frontline healthcare workers. And we are still fighting to have all healthcare workers included in the recently announced $2 to $3 premium for PSW. So we are at the table. Your president and officers are doing everything and anything we can to make sure that the message is being heard. And that also includes Directive 5 changes. So if you're not familiar with what Directive 5 is, don't worry, but I need you to go to our website because it's really important. We wanted to make sure that all frontline healthcare workers had access to the PPE they needed to perform their jobs properly. And so again, along with Unifor and CUPE, we sued, that's right, we sued the government, and as a result, achieved important improvements to Directive 5. All right, WSIB. WSIB is really important, and because of that, we have a specific department dedicated to just WSIB claims. As of 2020, we had over 600 claims at the board and 73 plus at the tribunal from over 100 different workplaces. This year alone, we have had over 150 members request our assistance with a WSIB appeal and employer appeals. And since 2015, this is the big number really, that if you're going to pay attention to probably matters the most. Since 2015, we have won over 340 claims, paying out our members over $8.3 million. Okay, so WSIB, when you get sick or an accident happens on the job and you're no longer able to work, like in a pandemic, we are able to step in for you and help you. And during COVID-19, we have assisted over 360 members with the process of how to submit a Form 6 claim. Whew, okay, you guys still with me? Yes, thumbs up, cool. So let's talk about your structure. So you met your officers, those are elected officers. So they're not appointed, they are there through your vote. But we also have amazing staff who are with us. and help every day to make sure that you are serviced properly. And that includes an administration department, very amazing high functioning comms team, an education department, which is me, finance, government relations, IT, member resource center, research, organizing, both internal and external. So folks who are bringing new members like you into the union. And then, of course, servicing, which is so important. You'll see the reps with us today. Their job is to help fight with you and work with you as a member through labor relations. Then we have our leaders and executive boards, so our governance structure. So these lovely folks that you're looking at are your executive board. And we'll go to the next slide and I'll quickly break you down its structure. So the E-board consists of different seats that represent our membership. So the 3 officers you saw there, Charlene, Tyler, and Mina, the nursing division president, Jackie Walker. We have 3 sectors represented here. So home care, hospital, and long-term care, 7 community seats from equity-seeking groups, Aboriginal Indigenous peoples, LGBTQI2, persons with disabilities, retirees, women, workers of color, and young workers. And then the 8 regions, like I told you, the expansive geography. And so the role of these positions are to bring forward specific things that matter or are relevant to the seats. So for example, your Thunder Bay executive board member is going to come to these meetings, which happen quite often, and advocate and bring forward specific issues that are happening in Thunder Bay. And these are all elected seats, and they govern the operations of our union. Oh, member service center. So if you are going to take top 3 things away from this interaction here, you want to go get a pen because this is probably number 1 thing that you should take. We have a member service center. The phone number is 1-877-672-7348. And this service center is like a call center. So from Monday to Friday, 8:30 to 4:30, you have the ability to call in and ask anything relevant to the union, of course. And somebody will pick up that phone, a live staff person on the other end, and help you out. If you have a question, maybe about your collective agreement, or you're not sure about your seniority, and you can't find your steward, you definitely want to call the member service center. And of course, connect with us. We want to hear from you. This is our website. Please follow us on Facebook, Twitter, and Instagram. And our member portal, this past summer, we launched a new online member portal so you can access important information at your fingertips, including your collective agreement. So if you've already gone on here and you can't download it for whatever reason, go ahead and call the Member Resource Center. But your collective agreement should be uploaded there for you, as well as the steward contact information, important announcements, and e-learning, which we're going to talk about in a minute. Things to look out for 2021. We are launching a mobile app, which is super cool. I'm very stoked. It's going to bring us together even more closely so that we can connect. We are going into central hospital bargaining. So what does that mean? We're going to sit at the table with the employers and we are going to fight for you, get a new contract, and win some big improvements. We're also going to be doing that in our long-term care sector and home care community. And we're going to fight for WSIB coverage for developmental service workers.